These days, hospitals and healthcare systems and physicians and other clinicians are under enormous pressure to shift from fee-for-service to value. Without some sort of model to re-engineer the delivery of care, this is a difficult journey. By participating in the PSH Learning Collaborative, people learn from each other, so you can accelerate that transition and transformation from fee-for-service to value. By working with others in the collaborative, you can find who's doing something really well that you're doing poorly in, and then talk with them directly, network with them directly, and learn how they got over those obstacles. Members who participate in the core collaborative are generally folks who've read about the perioperative surgical home, but really have been struggling to get off the ground.
The first iteration of the collaborative that we participated in was a great experience. We got to really learn the process of the PSH from the ground up. I think moving into the 2.0 collaboration, we had to start working on some of the more granular details, like working on submitting data and trying to benchmark our data against other organizations.
One of the benefits of participating in the advanced cohort as a part of the Learning Collaborative has really been an opportunity for our institution to develop the data collection tools that were required for participation. The obligation to produce data really drove the development of a team at our institution.
We started with total joint replacement of the lower extremity. That was the first thing we did. We soon added hip fracture, which is a separate diagnosis-related group. We then used some outpatient surgeries in orthopedics, such as shoulder arthroscopy, ACL repair. Then we used some of the same techniques with our general surgeons to improve our SSI rates and length of stay in colon resection. We've standardized our process treatments in hysterectomies and C-sections, and we've divided all of our physicians up into small groups so that we can standardize processes in cardiology, in hospital medicine, in emergency medicine, and try to improve care throughout the system with our physicians.
The first 5 that we've started with were mastectomies for breast, bariatrics, head and neck cancer surgery, spine, and then hip and knee replacement. The 2 that we've recently added on were stroke and then HIPEC, which is hyperthermic intraperitoneal chemotherapy.
In our perioperative surgical home results, we have seen a decrease in readmissions of about 43%. We have had a pain reduction from an average of 3.9 down to 3.2, so our patients are experiencing less pain in the immediate postoperative period. And then also we've had a very good increase in patient satisfaction scores after they come back to the office.
The most important part is that you're actually helping the patient, because when they have fewer complications, when they don't get readmitted to the hospital, that's less time away from family, less time away from the work.
By decreasing the total length of stay, decreasing our readmission rate in total joints from almost 10% down to 3% over 3 years, decreasing the length of stay from 3.2 days down to about 1.5 days for these joints. That's a big satisfier for physicians. From a patient's perspective, looking at the perioperative surgical home, I think this is very exciting for them, because the patients really care about quality considerably. As soon as the decision to have surgery is made, we start optimizing their care so that we can improve their care before they even have surgery, and things that will improve their outcomes, like smoking cessation and getting their diabetes under control, and even weight loss and improved exercise and nutrition, are things we can work on them potentially months before they have surgery. And we've literally had patients who finished having their total joint and told Dr. Allen, one of our orthopedic surgeons, that thank you for fixing my knee, it changed my life, but what changed my life even more was the fact that you had me stop smoking and lose weight. And that's going to go with me a lot longer than this total joint probably will.